Welcome to our airway management simulation training with Smart Airway, focusing on jaw thrust technique. The jaw thrust maneuver is a technique used in airway management to open and maintain a patient's airway, particularly in cases where cervical spine stability is a concern, or when the patient's head and neck need to remain in a neutral position. It can be performed rapidly and does not require any equipment. It is often the first intervention performed in a patient with a compromised airway. Here's how the jaw thrust maneuver is performed. Place your fingers between the angle of the mandible and TMJ on both sides. Use your index fingers and middle fingers to lift the mandible firmly, avoiding pressure on the soft tissues of the neck. Apply upwards pressure to the mandible with your fingers, displacing it upwards while maintaining the head in a neutral position. In a real patient, assess the effectiveness of the maneuver by confirming that signs of airway obstruction have improved or resolved. Look, listen, and feel for chest rise and fall, breath sounds, and airflow from the mouth and nose. Monitoring. Continuously monitor the patient's airway and respiratory effort. If the patient's condition deteriorates, or if there are signs of worsening airway obstruction, reassess and consider alternative airway management techniques. Smart Airway will guide you on the proper technique. Both sides of the mandible should be lifted with appropriate technique. Smart Airway will report instances when this is not achieved.